can you tell us a little bit about the intersection between bipolar disorder and the increased risk of suicide?
Well, unfortunately, that is a real intersection there. Folks who suffer from bipolar disorder are at a higher risk for suicide. There's a lot of data to corroborate that. And the hardest part about, this tragic outcome is really that it's hard to predict, just like what Tripp was mentioning about his personal story there. Obviously, it's just general clinical management and help and I guess the pillars of trying to help someone who struggles with bipolar disorder, which part of that is medications that might help, often help actually. Also, lifestyle changes that will improve general health and sleep, regular exercise, staying away from self-medication with alcohol and drugs. I mean, those are all important areas to focus on, as well as psychotherapy, psychoeducation for the patient, as well as the family. I mean, you get those all together. Unfortunately, it's not an illness we can cure yet, but we can control well, like we control high blood pressure or diabetes. But it's kind of like a struggle that goes on for a long time. People are well till they aren't. And usually more stressors or times when we let our guards down a little bit, you will see that if you know anyone is struggling with diabetes is no different. You're doing well till the things that have helped you get well, it may feel to you that you don't need them as regularly anymore. So, as a loved one, as a family member, being there to help the person realize early on when they are beginning to relapse or descending into depression or getting that next manic episode, very important. Bringing the person for help and little tweaks that may be needed in the treatment plan sooner rather than later. But the reality is that sometimes, no matter what we do, we aren't able to prevent this tragic outcome of suicide. uh, Treating, getting the help lessens the risk for sure, but in some cases, it happens no matter what we do, and that's very tragic. That's why the science needs to advance. The science of predicting suicide at an individual basis, it's just not there yet. So we work at a population level where we know, getting people into treatment, helping them stay away from self-medication with alcohol and drugs, understanding the value of medication, psychotherapy, empowering themselves to live a healthier life, have a healthier lifestyle. That all helps, but it's not 100%. And that's the tragic part. And that's why the science in this field needs to continue to advance, where hopefully we'll get to a point where this can be prevented. And we're not going to see, parents like Tripp having to go through this devastating loss. I mean, I'm a parent myself. I can only imagine, Tripp, the pain that you've gone through.